All right, I guess we're live. Excuse me. Press Maycock here doing a recording for the really some clinical pearls that we got from Dr. Brandon Lundell's Functional Medicine Practice Accelerator seminar in early June. And this is part two. Part one was recorded last week. We're going to get right into it. So let me share my screen. Everything. Entire screen. There. And there we go. Let's see here. Let's see if I can get that in presentation mode. All right. Well, welcome. I'm Press Maycock, as I mentioned. This is This is supposed to be part two of two, so I didn't update this slide. But real quick disclaimer: this is for healthcare professionals only. It's not intended to diagnose, treat, cure, prevent any disease. This is the sole opinion of the author, Dr. Lundell. Doesn't represent a claim that a nutritional supplement or alternative procedure should be in place of conventional medical evaluation for treatment. And this content is not evaluated by the FDA. Today we're going to cover about 30 minutes and maybe some Q&A if you got some. This is being recorded. I want to cover really Dr. Lundell's intention and how to think. And we're going to do a quick review, and then we're going to go into specific supplements and certain categories, specifically sleep, gut, hormones, etc. And then I'll tell you about some continuing education. So Dr. Lundell's mantra is good practitioners know what to do, but great practitioners know why. Memorizing protocols, knowing specific lab markers, and knowing exactly that mean corpuscular volume, MCV, B12 is limited at best. So it's like he wants the clinical depth for us, not just protocol memorization. And he's inspired because really the world needs more of us to be excellent and as excellent as we can be. So the worst approach, as he mentioned, involved memorizing supplement lists at the expense of understanding the real reasons below or beneath the physiology. So for example, what is CRP? He says, look, it's an inflammatory marker. Yes, but what is it? It's an interleukin. What's an interleukin? Inter means between, leukin is a white blood cells, meaning communication between white blood cells. So it's a chemical messenger. So then what makes the T cells secrete CRP? And where do these T cells exist? Well, they exist in the gut and the liver and the heart mostly. So if you have elevated CRP, then we're looking at liver, gut, or heart. And then we can ask, we can look at other markers, but also just see, do they have leaky gut symptoms or cardiovascular support needs or liver concerns? And so he believes that lab chemistry, blood chemistry, represents the most misunderstood and underutilized clinical tool to the modern physician. And a lot of practitioners don't know a quarter, or a quarter of the lab markers. They don't even recognize the tests or what they do. So again, we want to understand the physiology. We left at the end of part two with the autoimmune triad, and a study showed that leaky gut was part and parcel of autoimmunity. And so, yes, we have genetic predispositions, MTHFR, et cetera. Yes, there are environmental triggers, but intestinal permeability is part and parcel of that. And of course, that drives inflammation and dysregulates the immune system and is a cornerstone. And he mentioned identical twin studies, that there's only a 30% concordance rate with disease, meaning 70% is epigenetic. It's the environment. Your DNA is not your destiny. Now, he went into an anti-inflammatory diet, and he had two phases of that. He mentioned a healing phase where you remove grains, eat lots of veggies, lightly steamed to kind of prevent those, anti-nutrients. eat clean, good organic proteins, healthy fats, eliminate sugars, of course, which is the difficult part for a lot of folks. Feed the good bacteria with polyphenols and fibers. And he says, always run a food sensitivity test. And at the maintenance phase, you can move on to more grains, but you still need that food sensitivity test. He said that diet changes in general, most people feel better just by simply eliminating the crap, right? He called it the cardboard diet. So even if, and he even mentioned examples of people going on to a ketogenic diet that he does not think is a good idea, in part because it's bad for the microbiome, but people can feel good initially, in large part because they are removing some of the bad stuff. And he also mentioned that with a ketogenic diet, it can increase mTOR, which can increase cancer. And he's never seen a person on a ketogenic diet with a cholesterol lower than 300. So again, this is a bit of a review. For upper GI support, we've got HCl. That product in our line is called Hydrozyme. Digestive enzyme support, that would be a product called Bromelain plus CLA. And then for gallbladder support, biliary support, beta TCP, stands for, the TCP is taurine, vitamin C, and pancreolipase. He also uses beta plus, which is the organic beets, along with bile. And then with SIBO and SIPO, we have a 30-day SIBO kit, including a phase 2 kit. We're not going to go into that too deep today. But for leaky gut, he loves to use GI Resolve, and he loves to add N-acetylcysteine. If you watch the previous recording, he really loves N-acetylcysteine. He said this is his, like, outside of a multivitamin, going to a desert island, this would be the one formula NAC he would take. But GI Resolve, why he likes it, this is a powder. It has 4 grams of L-glutamine. That heals the gut lining. Z-carnosine has a ton of research on that. And then those mucilaginous mucoprotective elements with aloe and okra and deglycerized licorice. And so he talks about making a shake, and this is what he puts in his own shake, right? So he uses GI Resolve with the metabolic biome fuel. I had one today. It's a delicious shake. It's a superfood macro shake. It's got high quality proteins, high quality fats, and a diverse range of fibers. But he adds, which is biofiber complete, and he adds biofiber to the metabolic biome fuel. Why? Because the microbiome needs fiber, right? Low fiber, poor microbiome. And sometimes he'll add immuno-GG, or have his patients add immuno-GG SBI. That's the immunoglobulins that are like bouncers in the club that bind to antigenic antigens in the gut and take them out the back door in the stool. Now, this is a question I asked folks. Can someone have a high HbA1c and not be insulin resistant? It's tempting to just say, like, look at your patient and say, you're lying to me. You're lying to me. But what he explained was red blood cells live typically 90 to 120 days. And if someone is taking high quality antioxidants, the red blood cells are living longer and creating more time for those red blood cells to be glycosylated, because the HbA1c test is a test of glycosylation over time. So there's studies that show, like vitamin C or CoQ10 lower insulin, lower glucose levels, but they're not having the same impact on HbA1c. And that explains why, because the red blood cells are living longer. So it doesn't mean the protocol is not working. It means it's great. So you're protecting the insulin receptors, you're protecting the cell, you're extending the life of the red blood cell. And so even at a blood glucose of 85, for example, glycosylation happens at every level of blood sugar. It's just happening slower. It happens faster if there's higher blood sugar. So again, if you look at other markers as well, like fasting blood sugar, and if that's normal, then that's kind of the tell that this isn't true insulin resistance, and it's actually a byproduct of an extended lifespan of the red blood cells. So what controls electrolytes in the body, he asked. And I said, aldosterone. I was kind of right. It's the adrenals, and the adrenals secrete a class of corticoids called mineralocorticoids, and they produce both, the adrenals that is, produce both glucocorticoids and mineralocorticoids, aldosterone being the main one. Now, the pregnenolone steal or the cortisol shunt is real. It's a real biological mechanism where the adrenals, when they start to fail, the enzymes get shunted towards making the glucocorticoids, in part from inflammation and mandatory for blood sugar handling. But to preserve that function, it's at the expense of the mineralocorticoids. So when you stop producing mineralocorticoids, you dump your minerals. And so that's one of the earliest signs of adrenal insufficiency is low minerals, especially sodium, zinc, and calcium. And so that affects blood pressure, which is why people who, first of all, they have a tendency, with weak adrenals, they have a tendency to crave salt, but it's also why, from a blood pressure perspective and an autonomic nervous system perspective, why they can tend to have dizziness or low blood pressure, foggy thinking, orthostatic hypotension. They're oftentimes dehydrated. So what he said was the first thing you do with a patient with adrenal insufficiency is always provide them with minerals, because the mineralocorticoid deficiency drives a loss in sodium relative to potassium. Now, when he gives adrenal support, what his strategy is, he gives the minerals. He gives multi-mins, which is a breadth of minerals, along with electrolyte forte that gives also some of the macro minerals, along with some of the minors. But the combination is what covers those bases on the minerals front. And then he gives vitamin C, because where's the highest concentration of vitamin C in the body is at the adrenals. So vitamin C, and we talked about that in the previous recording. So if you haven't seen that, I would highly suggest checking it out. So he gives vitamin C, but also cytozyme AD, which is our neonatal glandular. And he said, think of them as like adrenal peptides. If you're trying to build adrenal function, you want to give adrenal parts. In the olden days, giving adrenal glands was the first form of vitamin C. So anyway, so the third thing is he'll give pregnenolone, because you are getting the pregnenolone steal. He says it's a very safe hormone. DHEA, if it's needed. If the test is low, you can use that. Now, you got a couple functional tests that you can do. Ragland's test, that's the one where you lay your patient down for about 10 minutes, take blood pressure, have them to baseline, and then have them stand up and take a blood pressure real quick. And if the blood pressure doesn't rise 5 to 10 points, then it tells us they've got this hypotension, autonomic nervous system, specifically sympathetic tone is poor, and adrenal function is poor, and that's a tell. The pupillary dilation test is another one where you can, in a dark room, bring a pen light just to the kind of side of their eyes and see if that pupil dilates or constricts down. What you'll find is with people with poor autonomic nervous system tone or poor adrenal tone is they can't hold the restricted pupil. And so that's another functional test you can do in office. Now, this is a big thing. The body's going to compensate excess or deficient hormones by regulating the receptors. And he feels like this is such a big, an important thing, because he used an example of a patient, a man could have low testosterone levels of 300, but feel fine because his body upregulated testosterone receptor sites, number, and function. And the same is true on the opposite end. We give super physiologic doses of T3, like Cytomel or Armour, that's going to create a T3 resistance in the body. Now think about how many people are on these T3 things, and then the medical doctor or whoever the prescribing physician is continues to increase the dose. Why? Because the receptor sites have downregulated. So he said, quoting, if you want to use a little T3 first for a few months, you can grease the wheels a little bit and helps, kickstart things, but you're going to drive mitochondrial destruction and thyroid receptor site downregulation. Unless they have a true destruction of their thyroid, no one should be put on T3 long term. I know that's controversial, but you'll soon learn why. So he said, look, for support steps for the thyroids, you have to optimize the 5-deiodinase enzyme family. He reminded us the cofactors for that are selenium, zinc, and D. And you got to heal the leaky gut because reverse T3 is actually made in the gut. And reverse T3 almost always tells you that there's inflammation in the gut and a liver detoxification problem. And so heal the liver, and to address, again, that was in the prior recording, address the reverse T3. So phosphatidylcholine can help with that, and acetylcysteine can help with that, Capares can help with that. He's never had a patient that he wasn't able to get the reverse T3 and the T4 levels normal. He said, one more time, treat the patient, not the labs. If they're feeling better, if they're overweight and they're now losing weight, they don't have to have a T3 of 4 or a T3 of 3.5. No, because what happens in the body begins to respond better to the thyroid hormone. And even at the same blood level. So you can, when you have or change the cellular response of the thyroid receptor, you can change the body's response to thyroid hormone tenfold. Most functional endocrinologists are not thinking this way, or if they are, it's still at an inadequate level. And so here's 8 principles of his functional endocrinology. And this first one, the production and secretion, is where most traditional endocrinologists ends. Here, something's missing, I'm giving it to you. But there's also transportation, like sex hormone binding globulin. There's pre-receptors. Again, we mentioned the 5-deiodinase enzyme family. A drug example of that affects the estrogen receptors is tamoxifen. And he said, what nutrients do that? We've got a lot. And the nutrients that modulate and positively activate the thyroid receptor, the retinoid receptors, they need vitamin D, they need vitamin A to operate. You also have the receptor itself. Think receptor detox as well. Post-receptor, that's the phosphorylation, the enzyme activation, in the cytosol. And then there's the translation, gene activation, transcription, production of the hormone effect, self-regulation, which is the counterbalancing effect, the signal modifications, the stop genes. And then, of course, elimination, the detoxification. Biliary, GI, or urinary. So that's a pretty exhaustive list, and obviously I didn't go into the details here, but it's how he thinks from a functional endocrinological way, and it's looking at the whole system. So he says there's so many things you can do before giving T3. GTA Forte is what he prefers to use. Is what the product he goes for most often if he needs that direct thyroid support. Now, he said something pretty controversial. He said, never supplement with just fish oil. And the reason for that is you can saturate the delta-6 desaturase enzyme and create a functional omega-6 deficiency because there's only so much delta-6 desaturase to go around. So his favorite oil, and I always love it when one of my mentors mentions a product that is his favorite, and it's something I'm taking, is EFA Cert Supreme. Now, this was designed by cardiologist Dr. Mark Houston, but it has the EPA, the DHA, and GLA, the anti-inflammatory GLA, along with some mixed tocopherols that are all super supportive for heart and muscle. And so that's my favorite oil too. So I was happy to hear him say that. Biomega 1000 is a high potency omega-3. That's the best. But he says with a balanced diet, that's great, but don't use it long-term by itself. I'm sure dose has a lot to do with it, but keep that into consideration. Now with antioxidants, your fish oils, because they're susceptible to oxidation, he recommends taking it with an antioxidant. Again, his favorites are N-acetylcysteine, bio-FCTS, which we didn't talk about much, Capares, Phosphatidylcholine, we did talk about in the previous recording a lot. Bio-C plus or biocyanidins. And biocyanidins, he feels like it's less known, but an excellent formula for a number of reasons. So let's dive into that. So it's a simple formula. It's got grapeseed extract and pycnogenol. And he says pycnogenol increases natural killer cells. So it's great for any kind of immune problems, including cancer. It increases adrenal function. It improves hormone levels, testosterone, estrogen, and progesterone. So if you're looking at like menopause, fertility, low T, you can use this formula. And then grapeseed extract. He really opened my eyes. Dr. Lundell really opened my eyes to the range in uses of grapeseed extract. And so it's an aromatase inhibitor that's better, it's superior to DIM. Again, the aromatase inhibitor helps prevent the conversion of testosterone over to estrogen. And that's very common nowadays, just from, adipose tissue or, excess adipose tissue secreting inflammagens, or and then elevated insulin, which is part and parcel of the same thing. So it can be really helpful for folks as an aromatase inhibitor. He mentioned that apigenin was also very excellent, and you can find that in receptor detox. But grapeseed extract by itself is neuroprotective. It helps leaky gut. It's part of this fatty liver protocol. It outperforms curcumin in many ways, and it's more absorbable. Now, grapeseed extract is also in BioCardioCert BP. That is another formula that I take, so I was really excited to hear about that. And we talked about taurine as well in the previous recording. Now, sleep support. He just did an excellent, Dr. Lundell just did an excellent webinar that in an hour, he crushed it. He had so many important pieces to the sleep equation. But he highlighted the de-stress peptides and the sleep tides, and then sleep tide synergy that brings those together. So what are they? The de-stress peptides are casein derived. It's not casein, because the casein itself is hydrolyzed down into peptides, small amino acid chains. And it works on GABA A receptors. So it increases GABA sensitivity, which allows us to calm down. I took some today and have been taking it for the last few days, just because of the stress of getting all of this stuff together in life. And the dose can be like 1 to 6 a day. So it's kind of a big range there. Body weight and the severity of the anxiety could be really important. I do want to just discuss the casein again. A lot of people think that, well, it comes from dairy and my patient's dairy sensitive. Unless they're very, very, very sensitive, it's quite rare. It can happen, but for almost everybody, it's not an issue, because it's no longer the casein protein, which is a very complex thing, whereas the peptides themselves are small fractions. It's also important to know that the GABA A receptors create calming without sleepiness. So it's helpful for evening sleep, but you could take this during the daytime as well. Now, let's pivot over to the sleep tides, because this is a brown rice protein derived formula, and it works on the orexin pathway, which is modulates arousal. And so by dampening that, it lowers cortisol, lowers epinephrine, lowers norepinephrine levels, and it only lowers it if it's too high. So it also doesn't lower morning cortisol, and the dose is just 1 before bed. And the reason is that 1 capsule saturates all of the orexin receptors. Now, sleep tide synergy is what I've been focusing on, in part because sometimes we don't know if a patient needs GABA support or the orexin cortisol pathway needs dampening. And if I can be more efficient with my protocol and get them both in one, that's what I'm doing. So sleep tide synergy combines those two. The dose is still 1 before bed, in part because of the sleep tides. During the day, if you want to give de-stress peptides, additional ones, you can. Now, the sleep stack add-ons, and this really helped me. Dr. Lundell was talking about that a lot of sleep disturbances are due to inflammation, and it's driving MAO activity in the brain. So dampen, um, if we can dampen the inflammation, then we can improve sleep. So he suggests, and I've added to my sleep stack, N-acetylcysteine, just 1 or 2 caps at night, in part because it's an NMDA receptor antagonist. It tamps down glutamate, which is excitatory, and you can do it at day and at night because it doesn't induce NAC doesn't induce sleep itself, but glutamate builds up during the day, which of course can affect us at night. NAC can also be used throughout the day for addiction too. So that same kind of excitatory glutamate thing is happening with addicts. So for an acute dose, you're looking at like 3 to 4 grams a day. So just a little side note on addiction. Magnesium plays a role. Actimag Plus, and MGzyme are some options in the biotics line, but also Biomega SPM. Now, this is newish to our line, but there's thousands and thousands of studies on them. So biotics came and provided a superior specialized pro-resolving mediator formula. It's actually the precursors that support resolvins in the body, and we ultimately got more of the precursors, more than twice the number of precursors as our competitors, and a higher concentration of those precursors per serving per bottle, and a better price per microgram of the SPM precursors. But specifically, it was added at night because they're very potent at decreasing neuroinflammation of the brain. So that could be 2 to 3 before bed. I take some in the day and I take one. I save one for my bedtime stack. And then vitamin C, he also did. So now these are what I take. And it really has improved my sleep score considerably. And that's great to see, because I was actually having some challenges. I thought I was fine until I got an Aura ring, and the Aura ring was saying, your sleep's not fine, Press. So that was a little humbling. But vitamin C studies show that it improves both sleep latency and quality. So it's not, as Dr. Lundell emphasized, it's not just how long you sleep, it's how efficient you are at sleeping. Do you fall asleep faster? Do you go deeper? Do you go through your sleep cycles efficiently? And so BioC Plus, it says that it's probably about 250 to 500 milligrams of vitamin C before bed can be helpful. And it's helpful to divide those doses because the half-life of C is about 6 hours. So I take it in the morning and I take it at night. So it kind of covers pieces of the day. And of course, I eat foods that contain vitamin C. My favorite, BioCardioCert BP, in there again. I might have mentioned that. Now, he had some nuanced support for melatonin. Let me just check the time here. Okay, I'm a little bit over, so I'll go fast here. I started a little bit late too. He says it's optional to use low dose melatonin. He really emphasized low dose. He says melatonin is a hormone. So if you're taking more than 0.5 milligram or 1 milligram long term, you're not getting, you could be getting, excuse me, if you stay in those doses, you're not getting melatonin receptor downregulation. But if you're taking 3 to 6 milligrams a day, and a lot of people are, and he says there's reasons to take that. If you have cancer, and there's some other things, H. pylori, interestingly, then that can be helpful. But we don't want to be, you don't want to create melatonin receptor site downregulation. I thought that melatonin production just went down as we age, and that was just a byproduct of age. That could be true, but Dr. Lundell really felt that that was actually more of a byproduct of calcification of the pineal gland. But really, really importantly, the majority of melatonin is not produced in the pineal gland. So here's a quote from him. He said, he says, how does it work? How does it work, melatonin, that is, and what does it do in the body? You remind us, his mantra, Good doctor knows what to do. A great doctor knows why. So he says, if you don't know, this is what I want to teach you, because it allows you to apply the right therapy at the right time with the right patients. It's secreted by the pituitary, yes, but also secreted by the enteric cells. There are 400 times more melatonin secreted in the gut than in the pituitary. So what does it do? It does get secreted at night, but it does not induce sleep. It's the other way around. It is part of the sleep cascade, of which inflammation interferes. Hence our other products that we're adding, C, N-acetylcysteine, right? And so when there's inflammation, the body won't secrete melatonin. Melatonin's main action is on the clock gene, and melatonin's clock gene triggers the cellular mechanism of repair. It triggers microRNAs. It triggers autophagy. It allows the mitochondria in the cell to repair, and without melatonin, people don't repair. I prefer alpha theta ultra PM. I was taking 2, which would give me 3 milligrams of melatonin. I've since gone down to 1, so it's 1.5 milligrams of melatonin, but it has all the other anxiolytic botanicals like passion flower. It has L-theanine and some others that all kind of work, those anxiolytic herbs that all work in concert to calm. I find that I can get a great effect with a large number of people with that product. Now, adding it to the sleep tide synergy, now you're at a whole nother level of support and odds of improving a patient's sleep. So Dr. Lundell tests melatonin via doctor's data. It's an add-on to his hormone saliva test. And he said it's amazing how many people who are low in melatonin, but he said it's also amazing how many people are high in melatonin. And that may correspond or explain why those people who have taken melatonin, they're like, nope, not for me, doesn't work for them. So that kind of gets us into a critical concept that he wanted to emphasize: supplementation versus nutraceutical intervention. So if you're supplementing to fill a deficiency, that's what we call a supplementation. You know, the body secretes only about 1 to 2 milligrams of melatonin a day, as an example. But if you want a supra-physiological dose, that does something different, and that's what we call a nutraceutical, because at that point, you know, we're calling upon a pharmaceutical dose. We're doing something supra-physiological, something beyond what the body would normally do on its own. And that creates a different effect. Excuse me. So we call that a multiphasic response to a single nutrient. Drugs work the same way. And he used the example of tamoxifen. Tamoxifen at low dose actually promotes cancer. You have to get the therapeutic doses to actually decrease cancer. So just a really important concept that I wanted to make sure you guys knew about it. Now, I asked him selfishly, because I get this call, you know, a few times a month. Someone will say, Press, my patient has elevated morning glucose. What is going on? And it's a paradox, because ostensibly they should have been fasting all night. They didn't get up and eat in the middle of the night. So he explained that could happen if there's elevated nighttime cortisol or even elevated epinephrine or norepinephrine. So he mentioned that sleep tide synergy can help dampen that and improve sleep. It can be a ketogenic state as well, but a lot of times the first time you'll see with the mineralocorticoid deficiencies, coming back to the adrenals, is waking up to go pee all the time. So there are people, they might complain that they're drinking plenty of water and complaining of peeing all the time. It could be adrenal insufficiency. And so we talked about that they need the minerals. Water follows minerals, and water follows minerals, and minerals follow water. So we need to improve the mineral status of that patient to support them. But if it is truly a blood sugar imbalance, you know, people have poor blood sugar fitness, as a mentor of mine like to say, we got to make sure that they fix the insulin receptors, and we talked about that already. And then give blood sugar handling nutrients. Like at bedtime, you can give them bioglycozyme forte, which is great for low blood sugar, and add to that the sleep tight synergy, and it's going to help dampen the cortisol while supporting their blood sugar and what they need. And so we're wrapping up here. I wanted to give you a webinar special here. Margins do matter in your practice, and that was something that he really emphasized in his practice. He said, it's the difference between, having been a successful practitioner or selling insurance in 5 years. But so with Sleepside Synergy, that's my focus right now. I want to give you 20% discount. Each bottle is a 30-month supply because it's just one capsule per night, one capsule before bed. The wholesale price is $28.75. To do the 20% off, I need a minimum order of 6. Now, it's pretty easy ask to say, do you know 6 people who could use support with their sleep? And many of us could use it ourselves too. So let's call it 5. But of course, in any practice, you probably have that amongst your friends, let alone in your practice. So you could try it out with 10, 6, whatever. But I can give you a one-time, and this is a rep-only discount. I have to place the order for you on your behalf, but it saves you almost $6, like $5.75 per bottle. Makes you a 70% profit margin on each bottle that you sell. And it's a pretty nice way to kind of try this product out and see how many people respond. And we all know that sleep's a major deal. No sleep, no heal. Bad sleep equals a cumulative repair deficit and faster aging, and increase in cancer and diabetes and dementia and cardiovascular disease and neurologic decline and more. So it's a practice building formula. If it works for people, they're going to be repeat purchases, and that's really a fantastic way. You don't have to sell someone something new or prescribe it to them. They can take this on an ongoing basis. It's non-addictive. It doesn't create any lethargy in the morning. And as they begin to improve their sleep structure, their natural rhythms will align, and it'll work even better. All right, so that's that. Lastly here, if you want more mentorship with Dr. Lundell, he has a mentorship program. It's an intensive. It's a 6-month with one-on-one tailored guidance, full summaries. You get group meetings and a whole set of labs. Like it's actually $2,800, I think it is, in bonuses just by partnering and becoming part of his mentorship program. And so that mentorship price is almost $4,000, but when you take $2,800 off it in the different discounts that you get from the partners, it brings it down to about $1,200. So something to look at. You can find his information at nutritionalpathology.com. And then I am trying to get folks out to the Epic Functional Medicine Conference in 2026. This is truly a world-class event. There's 6 different speakers and 3 different topics over 3 days. And you head out there in beautiful Sugar Land, Texas. The hotel where it's hosted at is in the middle of a hub of restaurants and shopping, and a lot of people in that area come directly to this location, for their dates and for shopping and all that kind of stuff. So, and the hotel is in the heart of that spot. So it's really neat to be able to have an event, and then you go out for dinner or what have you. You can bring a spouse or what have you. The registration is $497 until September 30th, and it pops up to $547. Now, my concern now is not the price and getting a discount, which is great. My concern now is the sellout risk. And so we've got some fantastic speakers. Let me see if I can just pull that up for you real quick. Boom. We go to speakers and topics. We've got the hormone scholar, Lindsay Berkson, top of her game right now. Really, really amazing. Now, Dr. Greg Jones, he's new to me, so I can't really speak to him. He's going to be talked about peptides and precision supplementation. Dr. Jennifer Stagg, who really popularized and shared to the world the specialized pro-resolving mediators. And then Dr. Brett Wisniewski, who is also works with Dr. Brett Lundell. He is super sharp. We talk about thyroid. Dr. Gerald Mullen, he's one of the key authors on the landmark study that showed that herbal therapy could beat or equal rifaximin therapy and do it naturally. And David Brownstein, probably a doctor that probably doesn't need any introduction. He wrote, he's going to be talking about iodine, the most misunderstood nutrient. And he has probably the most experience of any clinician, maybe worldwide, in using iodine. So you really can learn a lot from him. So again, 3 days, 3 topics, fantastic location. I am excited to share that with you. I want to go back there with an awesome team, and with that, I'm going to let you go. And if you have any questions, I want you to text me or email me, and I appreciate your time. Thanks so much.